Each morning, thousands of older adults across the country wake up and do what they've been taught is right. They attend regular checkups, listen carefully to medical advice, and agree to tests they believe are protecting them. These choices feel safe, responsible, and wise. But what if I told you that some of these same tests, the ones meant to safeguard your health, might actually increase your chances of suffering a stroke, not in the distant future, but within a single day? It sounds hard to believe, especially when you've always followed the rules, taken your medications, and trusted the system. But hidden within the routines of modern healthcare are risks that are rarely discussed openly, risks that become even more relevant after the age of 60. Some of the most common medical tests can place unexpected strain on your body. They can raise your blood pressure suddenly, trigger blue vessel spasms, or cause small clots to form that travel silently through your bloodstream and lodge in your brain. That's how a stroke begins, often without warning. You won't read about this in most clinic brochures. Your nurse may not mention it. And sometimes, even your doctor might not bring it up. But as someone who has seen the aftermath in real patients, I believe you deserve full transparency. In the next few minutes, we'll take a closer look at 8 medical tests commonly ordered for people over 60. You'll learn which ones carry hidden stroke risks and what questions you should ask before agreeing to any of them. If you're in your 60s or beyond, I encourage you to stay with me, because the decision you make at your next appointment may affect far more than just your test results. It may shape the rest of your life. Now let's begin with the first test, one that millions take after age 65 thinking it will save them, not knowing it may do the opposite. 1. CT scan with contrast dye, a hidden stroke risk overnight. Let's begin with one of the most commonly ordered tests in older adults, the CT scan with contrast. At first glance, it seems like a helpful and harmless procedure. Your doctor may suggest it to get a clearer picture of what's going on inside. And the phrase "better safe than sorry" feels comforting. But if you're over the age of 60, this test could carry risks that are not always discussed and might even set off a reaction that leads to a stroke within a day or two. Let's walk through why. When a contrast-enhanced CT is ordered, a special dye, usually iodine-based, is injected into a vein. This helps the scan pick up more detail, making it easier to detect tumors, blockages, or internal damage. While the technology is impressive, the dye doesn't come without consequences. For seniors, especially those with high blood pressure, weakened kidneys, or any degree of cardiovascular disease, this dye can quietly become a threat. It doesn't cause immediate pain or alarm. In fact, you might feel perfectly normal walking out of the imaging center, but behind the scenes, the contrast dye may be tightening your blood vessels, triggering minor spasms, disrupting your heart rhythm, or sharply raising your blood pressure. It may even impair how well your kidneys filter waste for a short time. All of this can quietly increase the likelihood of a clot forming, and if that clot finds its way to a small artery in your brain, the result is a stroke, not days or weeks later, but possibly within 24 to 48 hours. I remember Mr. Ray D. clearly. He was 83. A retired postmaster from Indiana, still sharp, still mobile, still engaged with his community. After some abdominal discomfort, his doctor ordered a contrast CT to rule out anything serious. Ray felt fine after the test. He even chatted with the technician and walked out smiling. But 2 mornings later, he woke up slurring his speech. His face was slightly uneven. His wife called for help. The hospital confirmed it was a minor ischemic stroke. No major warning signs beforehand. No alarming test results, except the one that may have caused it. Ray wasn't in bad shape. His blood pressure had been moderately high for years, and his kidney function had declined with age, like many seniors. But no one flagged that combination as risky. No one paused to ask whether a contrast-free scan might have sufficed. That's where the problem lies. The risk of contrast-induced complications in older adults often goes unspoken. It's printed in fine lines of academic journals or dismissed as rare in patient handouts. But in my experience with aging patients, it happens more than people think. What makes this risk so dangerous is how silent it can be. There's no dramatic moment, no sudden collapse. It starts as a subtle shift in blood pressure, a vague sense of dizziness, a moment of mental fog, and then it becomes something bigger. The mechanism behind this is straightforward. The dye stresses the vascular system. It can temporarily damage the kidney's ability to remove toxins, leading to fluctuations in blood volume and pressure. At the same time, the body might respond by activating clotting factors, resulting in tiny clots circulating through the bloodstream. These microclots are the real danger. All it takes is one, reaching a narrow cerebral artery for the stroke to occur. Could Ray's case have been prevented? Possibly. If someone had asked the right questions beforehand, is this scan truly needed? Could an ultrasound or MRI without contrast deliver the answer safely? Was his kidney function stable enough to handle the dye? Unfortunately, those questions weren't asked. That's why I now advise every older adult to take 3 steps before agreeing to a contrast CT. First, clarify whether the test is absolutely necessary. Second, ask if it can be performed without contrast. Third, make sure your kidney function and blood pressure have been checked recently and are stable. If those answers aren't clear, it's your right to pause and reevaluate. You're not questioning your doctor's skill. You're protecting your own life. And if you've ever walked away from a scan feeling slightly off, more tired than usual, or mentally clouded, don't dismiss it. Your body might have been trying to tell you something. Strokes don't always come with a thunderous warning. Sometimes they slip in quietly after we thought everything was fine. And that brings us to the next test. One that's just as common and even more provocative. Imagine a medical procedure where the goal is to push your heart harder, to raise your blood pressure deliberately, all in the name of finding hidden problems. Sounds helpful, but for seniors, it might be like throwing gasoline on a slow-burning fire. Let's explore the real risks behind the exercise stress test in part 2. 2. Exercise stress test. A ticking clock for stroke in seniors. Let's talk about a test that seems simple, even responsible. The treadmill stress test. For many older adults, it feels like the right thing to do. A proactive step. After all, who wouldn't want to know how their heart is doing? Just walk on a treadmill, get hooked up to monitors, and check if everything's functioning as it should. But if you're in your Altmush, 72nd or beyond, especially with a history of high blood pressure or vascular issues, This type of test may carry more danger than benefit, and the risk is not always immediate or obvious. It can quietly unfold in the hours after the test, sometimes overnight, with symptoms you didn't expect. A stroke brought on not by disease, but by the test itself. Here's what's really happening inside your body. During the stress test, your heart is intentionally pushed harder than usual, your legs are moving, your breathing quickens, and your blood vessels are constricting to handle the extra demand. This puts your entire cardiovascular system under intense pressure, sometimes more than it has experienced in years. For a healthy young person, this might be a good challenge. But for an older adult whose arteries have aged, whose vessel walls may be thinner or partially blocked, this is a different story. This is strain. This is risk. And it can tip the balance toward a clot, a rupture, or both. I remember Margaret S., a 74-year-old retired librarian who came in with nothing more than fatigue. No chest discomfort. No dizziness. No known heart trouble. Just a little more tired than usual. Her doctor recommended a treadmill stress test to rule out cardiac causes. She agreed, thinking it was just routine. Margaret completed the test without major issues, though she felt unusually breathless and lightheaded at the end. She went home, rested, and tried not to worry. But the next morning, her right hand felt weak. She couldn't grip her coffee mug. Her daughter noticed her speech sounded different. At the hospital, the MRI confirmed it. A mild ischemic stroke, likely caused by a sudden spike in blood pressure or a clot that traveled after the test. She was lucky to survive, but her recovery has been slow. Physical therapy, home modifications, and a new chapter of dependence she never anticipated. The most painful part was realizing it all could have been avoided. Her fatigue, it turned out, wasn't heart-related. Blood tests revealed anemia and mild dehydration, two treatable issues that didn't need a stress test to uncover. And yet, that one decision, one well-intentioned recommendation, set everything in motion. What many people don't realize is that stress tests are not benign. They increase heart rate, elevate pressure within the arteries, and stimulate clotting responses in the body. If there's a weak spot in a vessel, the sudden pressure can cause it to leak or rupture. If there's a plaque, the force of exertion can loosen it. A clot may break free and travel to the brain. That's how strokes happen. Not always in the moment, but hours later when the body begins to settle. One study from the American Journal of Cardiology followed over 130 seniors who underwent treadmill stress testing. Within 48 hours, nearly 7% experienced significant complications. Some had arrhythmias. Others developed severe blood pressure spikes. And yes, a few had strokes. The highest risk group was older adults already dealing with hypertension or vascular, narrowing the exact people most likely to be offered the test in the first place. That's why I tell every patient over 60 to pause before agreeing to a stress test. Ask if you're experiencing real symptoms like chest pain or breathing difficulty. Ask if there are alternative tests that don't require physical exertion, such as pharmacological stress imaging or a resting echocardiogram. And ask if your current medications or conditions might make the treadmill approach too aggressive. Because the question isn't just whether your legs can walk the treadmill. It's whether your arteries can withstand what comes with it. Margaret later told me she never imagined a simple test could change her independence. She trusted the process. She didn't know she had a choice. But now she encourages others to speak up, to ask questions, because no one else will be living with the consequences except you. As we grow older, our resilience changes. We may feel strong on the outside, but our systems become more sensitive to stress. And unfortunately, the healthcare system doesn't always slow down to account for that, which brings us to a different kind of risk. Not from exertion, but from sedation. The next test on this list is one many seniors will face eventually. It feels routine, even preventative, but it can quietly open the door to vascular complications. Let's explore the hidden risks of endoscopies and colonoscopies, especially when sedation and blood thinners are involved. 3. Endoscopy with sedation. The silent stroke trigger hidden behind routine screening. Let's now look at a procedure that's widely promoted as routine and preventative for those over 60, the endoscopy or colonoscopy under sedation. And you've likely been told it's simple. Just show up, go under mild anesthesia, and be home by lunch. But if you're taking blood thinners or managing high blood pressure, this seemingly harmless exam can quietly open the door to a serious neurological event. The risk isn't always immediate or dramatic. Sometimes it shows up the next morning as subtle changes in speech, balance, or coordination. What many don't realize is that the sedatives used in these procedures can drop your blood pressure to levels that may disrupt the delicate flow of oxygen-rich blood to your brain. For those with narrowing arteries or compromised circulation, even a short drop in pressure can cause clotting or trigger a stroke. One of my patients, Eleanor J., a 6-year-old widow from North Carolina, learned this the hard way. She had no symptoms and no digestive complaints, but her doctor suggested a colonoscopy as part of a wellness check. Out of trust and a sense of obligation, she agreed. The procedure itself was uneventful. She was sedated and monitored carefully. Afterward, she was cleared to go home. That evening, she felt groggier than usual. By the next morning, she was unsteady on her feet and slurring her speech. Her son rushed her to the emergency department where she was diagnosed with a small ischemic stroke. The most likely cause was the combination of her daily low-dose aspirin and the drop in blood pressure during sedation. These factors together may have allowed a clot to shift or form, leading to reduced blood flow in one area of her brain. This situation is not rare. A review published in a major gastroenterology journal found a noticeable rise in minor strokes and transient ischemic attacks among adults over 65 who had sedated procedures. The strokes weren't always dramatic, but the signs were there. Slurred speech, confusion, weakness. Unfortunately, many of these are brushed off as post-anesthesia effects or aging. The issue is that sedation, by design, slows the body down. Blood vessels relax, pressure drops, and the flow of blood to the brain decreases. If a person is on medications like aspirin, clopidogrel, or warfarin, that reduction in circulation creates an ideal condition for clotting, and yet, because patients often feel fine going into the procedure and experience no immediate pain, the link between the test and the stroke is rarely made. I always advise my older patients to ask themselves a few questions before agreeing to these tests. First, do I truly need this procedure right now? Second, Are there warning signs or symptoms that justify going under sedation? And finally, are there safer ways to examine my digestive system? Perhaps with reduced anesthesia, or even none at all. You might be surprised at how often the answer is yes. Many of these exams can be adjusted or postponed until they are truly necessary. Eleanor's life didn't end with her stroke, but it changed. She regained much of her function after weeks of therapy, but she now lives with a slight tremor that reminds her daily of that experience. She told me later that she had walked into that appointment feeling perfectly well and came out carrying something she never expected. Her story is not unique. Across the country, many older adults experience CAROTID, unrecognized strokes after sedation. These moments are too often dismissed, not investigated, and never linked back to the procedure that caused them. And now, if this story concerns you, wait until we look at the next test. It uses a substance that requires your kidneys to work overtime to remove it. And in some seniors, the body can't eliminate all of it. That leftover material can linger and impact your brain in ways we still don't fully understand. Let's explore the risks of MRI scans involving gadolinium and why older adults should be especially cautious. If you're still with me and learning something valuable, I invite you to comment with the number 1 below. Let's now move on to number 4. 4. MRI with gadolinium. The heavy metal risk that lingers and strikes overnight. Let's take a closer look at a test often considered safe and advanced. The MRI scan, especially when done with contrast. For people over 60, these scans are commonly used to investigate everything from chronic pain to neurological symptoms. But what many older adults don't realize is that a large number of MRIs involve an injected contrast agent called gadolinium, a type of heavy metal that your aging body may struggle to eliminate. Gadolinium doesn't cure anything, and it isn't a medicine. It's added solely to make internal structures show up more clearly during the scan. The problem begins when this metal stays inside your body longer than it should. In healthy, younger individuals, the kidneys do a good job of clearing it out. But for seniors, kidney function can slowly decline without warning or symptoms. And in people over 65, it's not uncommon to have moderate kidney impairment and not even know it. When the kidneys can't flush out gadolinium efficiently, small traces of it may remain behind. Not just in soft tissues, but inside your brain and blood vessels. These traces can linger for long periods, and in some cases, they may cause inflammation or trigger changes in circulation. I remember meeting Harold C., a 9-year-old military veteran who came into my office a few days after having an MRI for back pain. His doctor had ordered the scan with contrast to rule out nerve damage. No blood tests were done beforehand. No questions were asked about his kidney health. 2 days later, Harold was confused, having trouble concentrating, and nearly fainted after standing up too fast. This was a man who'd been mentally sharp and physically steady just a week earlier. We ran tests and found he had stage 3 kidney disease that had gone undetected for years. The gadolinium hadn't cleared from his system as expected. It likely contributed to inflammation and possibly small clot formation that disturbed the blood flow in his brain. Harold slowly recovered, but he was frustrated. No one had warned him. No one had asked the right questions. And his story is not an isolated one. In a 2019 study published in a major radiology journal, Researchers followed over 2,000 seniors who had contrast MRIs. Around 5% reported symptoms like confusion, dizziness, temporary weakness, or visual changes in the days that followed. These signs often go unrecognized. Doctors may assume it's post-procedure fatigue or just part of aging. But in reality, these are early signs that blood flow in the brain may have been affected beyond neurological changes. Gadolinium has been linked to a rare but serious condition called nephrogenic systemic fibrosis, which causes thickening of the skin and muscle tissues, making movement painful and difficult, though uncommon. This condition has almost exclusively occurred in people with reduced kidney function. More concerning is the growing evidence that gadolinium can settle in brain regions responsible for memory and emotional control. It's not about one scan. It's about the cumulative effect, especially in older adults whose bodies no longer filter toxins the way they once did. If you're over 60 and your doctor recommends a contrast MRI, don't be afraid to speak up. Ask first, is it truly necessary to use contrast in this case? Have my kidneys been tested recently, and can we achieve similar results with a non-contrast MRI? These are reasonable questions, and they could spare you from potential complications that no one warned you about. Remember, just because a scan gives better pictures doesn't mean it's always the best choice for your health. Harold later said that if someone had explained even a small chance of harm, he would have thought twice. You should too. Now, if the thought of metal-based scans worries you, imagine a test that uses no dye, no drugs, and no pain, but still ends up pushing seniors into surgeries they may not actually need. That's what we'll look at next. The carotid artery ultrasound, and why sometimes getting a good result might be more dangerous than a bad one. Let's explore this in part 5. If you've stayed with me so far, drop a number 1 in the comments to let me know you're finding this helpful. 5. Routine carotid artery ultrasound. Let's talk about a scan that feels completely harmless. It doesn't involve contrast. There's no sedation. And it only takes a few minutes. I'm referring to the carotid artery ultrasound, often offered during routine wellness exams for people over 65. It seems like a safe extra step just to be cautious. Your doctor may suggest it during a checkup to see whether there's plaque building up in the arteries that supply blood to your brain. On the surface, it sounds like prevention, but in reality, this test may unintentionally place seniors on a path that ends in surgery, and in some cases, stroke. Let's be clear. The scan itself doesn't harm you. The problem is, what happens after the scan shows moderate narrowing, even in people who feel completely fine. When plaque is found in the carotid artery, a term called stenosis is often used for older adults with no neurological symptoms, no imbalance, no vision changes, and no signs of weakness. Even moderate narrowing does not always require surgical treatment, but the moment patients hear the words blocked artery, fear takes over. A surgeon is consulted, a procedure is booked, and that's when the risk actually begins. Surgical interventions like a carotid endarterectomy or stent placement can disturb existing plaque. That disruption can cause small clots to dislodge and travel directly to the brain. These events sometimes happen during the operation, but they can also strike later that same night. One patient I remember clearly is Helen M., an 82-year-old retired teacher who was active and mentally sharp. She agreed to a carotid scan during a Medicare checkup, even though she had no symptoms. The scan showed a 65% narrowing on one side. Her doctor explained that this could increase her stroke risk and recommended surgery out of concern and trust in the advice. She moved forward with the operation within a few weeks. Everything seemed to go well, and she returned home quickly. But that night, her daughter noticed Helen was speaking more slowly and struggling to grip a glass of water. Within an hour, she had lost strength on her right side. A trip to the hospital confirmed what we feared. A major stroke had occurred during recovery. Helen survived, but her independence was gone. She needed help walking, dressing, and speaking. When I met her later, she asked me a question I've never forgotten. If I felt perfectly fine, why did we even look? Her experience isn't unique. A large study published in the New England Journal of Medicine tracked thousands of seniors with moderate plaque but no symptoms. It showed that, in many cases, managing risk factors like cholesterol and blood pressure was just as effective as surgery. In fact, some participants who underwent surgery experienced strokes caused by the procedure itself, strokes that might never have occurred without the intervention. The issue here is subtle but dangerous. The test feels safe. The diagnosis sounds urgent. The treatment seems obvious, but in people without warning signs. Less aggressive options may be better. If your doctor offers this scan, don't hesitate to ask important questions. What are we hoping to find? Will the results affect my current treatment plan? If narrowing is found, do I have symptoms that justify surgery? And are there non-surgical options we can explore first? If you are already managing your health well, eating carefully, taking medications as prescribed, and not showing any signs of neurological changes, this scan may not be necessary. But if you go forward with it, understand that it could lead to interventions that carry real risks. One of the most alarming facts is that strokes following these procedures often occur during the early hours of recovery, when the patient is alone at home and no one is watching closely. And by the time anyone realizes what's happening, the damage is already done. Helen's story reminds us that just because we can do a test doesn't always mean we should. Sometimes the safest choice is to observe and wait. Not everything needs to be fixed. The moment it's found, especially when the repair itself could cause harm. But what comes next might surprise you even more. Because it's not a hospital test or a surgical decision. It's a device millions of older adults use at home every day. Often with the best intentions. Let's talk about how repeated use of home blood pressure monitors might quietly increase your stroke risk without you even realizing it. 6. Overuse of home blood pressure monitors. Let's talk about a tool many older adults rely on daily, often with the best of intentions. The home blood pressure monitor has become a staple in countless households, offering a sense of control and reassurance. For many, it feels like a shield against the unknown. But what most people don't realize is that using this device too frequently, especially without proper guidance, can quietly create the very danger they're trying to avoid. Checking your blood pressure multiple times a day might seem cautious, but in reality, it can lead to harmful decisions, including unnecessary changes in medication. Those adjustments can push blood pressure too low, especially during sleep. And in some cases, that's when a stroke happens. I've seen it more than once. Older patients who are diligent, even meticulous, about tracking their readings. They monitor every fluctuation, take detailed notes, and call their doctor the moment a number appears too high. But what starts as a safety measure can turn into a cycle of fear. That fear leads to quick medication changes, often without an in-person checkup, and that's where things go wrong. One patient who illustrates this perfectly is Walter D., a seven-year-old retired mechanic from Ohio. Walter was committed to his health. He tracked his blood pressure obsessively, checking 3 to 5 times daily and keeping a handwritten log. One evening, after seeing a reading of 158, he called the clinic. A substitute physician told him to raise his beta blocker dose for the night. The next morning, Walter collapsed in his kitchen. He had weakness on one side and trouble speaking. At the hospital, scans revealed a stroke caused by reduced blood flow, likely due to an overnight drop in pressure. His records didn't show a consistent pattern of dangerously high numbers. What I saw instead was a man doing his best, but reacting too quickly to a single reading. The truth is, blood pressure naturally rises and falls throughout the day. It changes with stress, posture, caffeine, and activity. One elevated result doesn't mean danger. But if every spike leads to panic and medication shifts, the risk increases. This is especially true during nighttime hours. As we grow older, our brains become more sensitive to changes in blood pressure. The ability of blood vessels to compensate for drops in pressure weakens. When blood pressure dips too low while we sleep, the brain may not receive enough oxygenated blood. That drop can allow clots to form or dislodge existing ones, leading to a blockage that causes a stroke before morning. Because of this, I now give my older patients very specific advice. Measure your blood pressure just once a day unless your doctor says otherwise. Choose the same time each day, preferably in the morning after 30 minutes of calm wakefulness. Sit quietly. Don't rush. Record the number, but don't obsess over it. What truly matters is the overall pattern, not a single high reading. And never make changes to your medication based on one result unless a doctor has examined you in person. These medications are strong and affect more than just your numbers. Your symptoms, kidney function, heart rhythm, and general well-being all need to be considered before adjusting a dose. Without that context, changes become dangerous guesses. Walter later told me he genuinely believed he was being responsible. He wanted to stay on top of his health, but the system didn't help him see the full picture. It treated his numbers like the only thing that mattered. That's the tragedy. He tried to protect himself, but ended up hurt because no one reminded him that blood pressure management is not just about reacting to a number. If you have a monitor at home, don't throw it away. Use it, but don't let it cause unnecessary stress. Don't allow one reading to dictate your actions. Be informed, not overwhelmed, because sometimes our attempts to stay safe backfire when we don't give our bodies time to self-regulate. And if such a small device can disrupt your body's balance, imagine what happens when seniors receive repeated dental injections that contain chemicals designed to spike blood pressure rapidly. Let's now turn to what happens in the dentist's chair and how numbing agents with added stimulants may quietly increase stroke risk in older adults. 7. Dental procedures with epinephrine-based numbing agents. For many older adults, going to the dentist for a filling or crown seems routine. You sit in the chair, they numb your mouth, and you expect a bit of discomfort, but nothing dangerous. What most people don't realize, however, is that a small injection meant only to reduce pain could quietly trigger a sharp rise in blood pressure, tighten your blood vessels, and in some cases, lead to a stroke before morning. This risk often goes unmentioned, yet it stems from one specific component found in most dental anesthetics, epinephrine. This is a synthetic version of adrenaline, used not to treat pain but to make the numbing effect last longer by narrowing the nearby blood vessels. It sounds helpful, and often is, unless you're over 65 and living with high blood pressure, cardiovascular disease, or a history of stroke. In these situations, the body may not handle the effects of epinephrine. Well, the problem lies in how this substance behaves after it enters the body. Although it's intended to remain local, in older individuals, epinephrine can escape into the bloodstream and circulate widely. This can result in a rapid heartbeat, sudden pressure spikes, and narrowing of already vulnerable arteries. When that happens, blood flow to critical areas, like the brain, can be compromised. A clot might form, or an existing one might shift, raising the risk of a stroke within hours. This is exactly what happened to one of my patients, Walter K., age 81. He was active, mentally sharp, and managed mild hypertension with medication. A long-standing fear of dental work had delayed a visit for a cracked tooth, but he finally agreed to go. The dentist used a common numbing injection that included epinephrine. The procedure itself was uneventful. Walter mentioned feeling jittery and flushed afterward, but the staff reassured him this was normal. That night, he went to bed early. The next morning, his wife noticed something was wrong. He slurred his words and couldn't lift his right arm. Emergency scans confirmed he'd had a mild stroke affecting the left side of his brain. With no other recent changes in health or medication, the only likely cause was the spike in blood pressure from the injection. Walter regained some function, but now uses a cane and finds reading aloud difficult. For someone who cherished story time with his grandchildren, this has been a painful loss. What makes this issue even more troubling is that most patients aren't informed they're receiving epinephrine at all. It's bundled into the numbing formula as standard practice unless you specifically ask. Your dentist might not mention it. This lack of transparency becomes a real concern for older adults whose arteries may no longer tolerate sudden pressure changes. A study in the Journal of the American Dental Association showed that seniors with high blood pressure or coronary disease experience significant increases in systolic pressure after receiving epinephrine-containing anesthetics. In some cases, that spike exceeded 180 mmHg, a level that can place immense strain on the heart and brain. Additional data from a 2021 case review found links between dental anesthetics and neurological events like transient ischemic attacks and stroke, especially in patients over 70. Fortunately, there are safer options. Anesthetics like carbocaine offer effective pain control without adrenaline and are often well tolerated by older adults. They may not last as long, but the trade-off is peace of mind and a lower risk of complications. If you're a senior preparing for dental work, take a moment to speak up. Tell your dentist about any heart conditions, blood pressure issues, or stroke history. Then ask directly, does the anesthetic contain epinephrine? Is there a safer alternative for someone with my medical background? You have every right to know what's being used and how it may affect your body. Walter's story is not an isolated one. I've heard too many similar accounts from older patients who walked into a dental appointment and walked out with a life forever changed. Not because of the dental work itself, but because no one warned them what a few milliliters of adrenaline might do to their already taxed cardiovascular system. These are the kinds of preventable stories that haunt me as a doctor, the kind that remind us that no procedure, no matter how routine, is risk-free, especially when the patient is in their 70s or 80s and their vascular system is no longer as resilient as it once was. If a small dental shot can set off a chain reaction leading to a stroke, what about the injections many seniors receive directly into their eyes to preserve vision? Let's now turn to anti-VEGF treatments and the surprising way they may be increasing the risk of blood clots in the aging brain. 8. Eye injections for macular degeneration. 8. The risk behind eye injections for macular degeneration. Many seniors rely on eye injections to preserve their vision, particularly those battling macular degeneration. Treatments such as Lucentis, Eylea, and Avastin are often described as miracles for maintaining independence and clarity of sight. But few realize that while these medications can save eyesight, they may also quietly elevate the risk of a stroke, particularly in those with pre-existing cardiovascular issues. The conversation in most eye clinics centers on the benefits to vision, rarely touching on the potential dangers to brain health. As a neurologist, I have observed a concerning trend among older adults receiving these treatments. These injections work by blocking a specific protein called VEGF, which encourages the growth of new blood vessels in the retina. This helps prevent scarring and bleeding that can lead to blindness. However, VEGF isn't exclusive to the eyes. It is essential for vascular health throughout the body, including arteries in the heart and brain. When VEGF is suppressed, even by localized eye treatments, it may compromise the integrity of blood vessels elsewhere. This disruption can make it easier for clots to form or migrate, possibly triggering a stroke during sleep. I remember a patient named Lorraine H., a 7-8-year-old woman from Ohio. She had been receiving regular injections for over a year and was diligent about managing her blood pressure. After her 6th injection, she mentioned feeling slightly dizzy and confused, but attributed it to fatigue. The next morning, her neighbor found her disoriented and slurring her words. A scan revealed she had suffered a mild ischemic stroke overnight. Nothing else in her medical history had changed. Although it's difficult to prove with certainty, multiple studies have identified a link between frequent anti-VEGF treatments and stroke events within 48 hours of injection. One study in particular, published in a reputable ophthalmology journal, showed that seniors over 70 who received these injections on a regular basis faced a statistically higher chance of experiencing strokes. Experts suggest this may be due to microscopic clot formation triggered by vascular destabilization after VEGF is suppressed. What's even more troubling is that eye specialists often don't screen for stroke risk. Their focus remains on retinal health. They may be unaware of narrowed carotid arteries, recent TIAs, or the patient's use of blood thinners. These missing pieces of information create a dangerous gap in care. Lorraine's stroke wasn't catastrophic, but it changed her daily life. She now uses a cane and has difficulty with memory She had no idea that something intended to protect her eyes could affect her brain. That's why I urge anyone over 65 receiving these injections to speak with not only their ophthalmologist, but also their primary care doctor and cardiologist. Ask if you're a candidate for spaced-out treatments. Inquire whether a less frequent dosage schedule is possible, and always report unusual symptoms immediately. Lorraine once told me, "I saved my vision but lost my freedom." Her story illustrates why patients must be informed of all potential risks, not just the ones related to sight. As we approach the conclusion of this discussion, it's important to step back and reconsider how we approach medical testing in general. Final reflection: not all tests bring safety. Some carry unexpected costs. Throughout this video, we've explored the risks hiding in what many assume are harmless procedures. As you've seen, even simple tests like contrast-enhanced scans, stress exercices, or routine sedations can have serious consequences for older adults. Bodies change as we age. Systems slow. Tolerance shifts. Yet the pace of modern diagnostics hasn't always adapted to this truth. Medicine often continues operating on routines developed for younger, more resilient bodies, but in a senior's physiology. Those same routines can tip the scale from safety into harm. The point here is not to cause fear, but to create awareness. Seniors need to be active participants in their healthcare decisions. You now understand how certain scans can raise blood pressure and stimulate dangerous spasms in blood vessels. You've learned that exercise tests can stress a vulnerable heart, and that even monitoring your blood pressure too frequently can lead to dangerous medication adjustments. Numbing shots at the dentist and medications injected into the eye can both spike vascular risk. Each one of these tests or procedures has a role in healthcare, but their application must be based on a full understanding of your health, not on protocol alone. So, here's my request to every older adult watching this. Before agreeing to a test, take a breath and ask key questions. Is this procedure vital at this moment? What risks does it bring considering my age and existing conditions? Are there safer alternatives, or can it be postponed? These questions are not signs of defiance. They are expressions of wisdom and self-preservation. I have seen too many seniors endure strokes, cognitive decline, and mobility loss not because of disease, but because of tests they never needed. But I've also met patients who stood up for themselves, who asked questions and avoided unnecessary risks. Their stories are proof that being informed saves lives. You have the right to understand. You have the right to ask. And above all, you have the ability to protect your own well-being. Medicine should not only aim to detect disease, it must also prioritize safeguarding life, and the life we're talking about is yours. If this message resonates with you, share your experience in the comments. Others might learn from what you've lived. Stay alert, stay thoughtful, and most importantly, stay in control of your health decisions. Because knowledge isn't just power, it's protection.